Good afternoon, everybody. Good to see everyone. Why don't we go through some COVID data, touch on some COVID-related topics, and then take some questions. As far as loss of life, we lost one member of the community for the last 24 hours. Female in her 50s, she had underlying conditions. Certainly, we're very, very sorry and thinking of her and her family at this moment. It's been a long pandemic. We're really in calendar year 3 of this, so certainly it's taken its toll. Related to hospitalizations, we're going in a good direction. There's 107 residents in the hospital. For context, last Wednesday there was 141 residents in the hospital, so a 25% decline over the last week. We have 16 residents in the ICU. At this point, which I think is about where we were yesterday, but again, week over week, we continue to see declines there as well, which is really the most important metric that we have with how we're doing in the pandemic. Hospitalizations is a lagger compared to cases. We've seen significant declines in cases week over week, and we're continuing to see that. It's just going to take a little bit longer with hospitalizations, and just a reminder that even though Omicron is what drove case levels to the peaks that we were at, we still had Delta cases there, and we still have Delta hospitalizations, and that was really what was driving the hospital numbers for the enduring part of our last 4th wave. New cases, 164 new cases. Give context, last week, same day, we had 270 cases. So 39% decrease week over week. Related to that, household contacts making up 1/3 of those cases. So we've seen cases exponentially dropping very fast in the 30 to 40% range each week. And certainly on our lower test days, you're going to see that number be a lot smaller. Wednesday, Thursday, Friday are typically larger days, but we were in the mid to high 200s last week. It looks like we're going to be in the 100s this week, so it's just a sign of where things are, which is moving in the right direction. Related to asymptomatic testing that we've been doing, we're going to focus more on getting out test kits through various distribution networks to the community. Overall, this is about getting people the infrastructure they need now at this point in year 3. To be able to be smart when you have symptoms, take the at-home tests. They're readily available. If you test positive, obviously go through, report that. But now that this isn't an issue anymore, we expect the at-home testing to be more and more of what happens. And again, that's why when we look at other metrics like positivity rates, they're really meaningless. Those are positivity rates of PCR tests taken through labs. Not the positivity rates of the community, because we know that there's tens of thousands of tests that are being taken on a daily basis with that. So we're going to be distributing through various networks, hospitals, food pantries, churches, nursing home staff, senior centers. When our probation department goes out on their calls, they're giving out test kits. School districts are getting test kits. This morning as I dropped my son off at school, I had 2 of them given to me, even though I know where to find them. And so there's test kits everywhere in the community. If people want test kits and for some reason you can't find them, you can please reach out to my office and we will arrange for that to happen. Related to where we are overall, we have a drastic decline in cases, and hospitalizations are going in the right direction. By the end of the week, hopefully we'll have hospitalizations under 100. Our hospitals are able to perform elective surgeries. We're going in the right direction and in a meaningful way. I asked the state health commissioner last week for metrics related to on-ramps and off-ramps for mitigation, understanding that the public policies we have other impacts related to public health. And we've not received those metrics. Therefore, if you can't put a metric for it, I don't believe you can justify the mandate. So our position at this point is that all statewide mandates need to be lifted. Related to school masking, that should be a community conversation between the school districts and their parents. And we certainly would encourage anybody to do what you're comfortable with. Just because there's no county-wide mask mandate or statewide mask mandate, if you're comfortable wearing a mask, that's what you should do. If you're comfortable not wearing one, that's what you should do. I went to Wegmans the other day, and most people were still wearing a mask, and they didn't need to. So I think that's, people need to feel like it's okay to do what you're comfortable with at this point. But we can't ignore the reality that public policies over the last 2 years have other unintended consequences. And certainly when we look at mental health and we look at that among adults and children, that's been a significant one. When we look at what's happened with the opioid crisis, which is going to really be a focus of our administration, along with trying to address the mental health crisis in our community moving forward. These are directly related to the pandemic, and in many cases directly related to some of the public health policies that may have been necessary at the time, but because of the on-ramp, off-ramp metrics, people have lost faith in, because we haven't been able to not just say what the metrics are, but explain them. So, in year 3, this is about giving people the tools they need to be successful, making sure that those tools are readily available, and continue to be prepared for the unexpected related to any curveballs that this virus may throw at us in the future. Similar to my position, I'm sure you saw that the Onondaga County BOCES and school superintendents put out a similar request to the state, asking for the off-ramp, encouraging the off-ramp related to masking. These districts are well positioned to work with their teachers and their parents, to figure out what's best for those districts. And I think it's certainly time for those discussions to happen, at recognizing that all the tools in the toolbox have been available to the workforce in these buildings for a year, if not more. We've had vaccines, we have booster shots, we have KN95, N95 masks. You going into school, you can't go into school with COVID symptoms still, and the data proves out. Last week we did 3,400 tests in our screening program. For the first time since November, the positivity rate was under 1% in schools. So we have the infrastructure in place to be able to lean forward on some of these mandates being lifted and make it up to parents and school districts on what their policies are moving forward, not a one-size-fits-all approach in what is a very, very diverse state. So saying that, happy to take questions. Yeah, I think related to where we're going with cases and understanding that cases today mean something different than what they did in the beginning of the pandemic. You have a variant that's twice as contagious, but not as lethal. You've had the ability for vaccinations in roughly 95% of the students, all adults, obviously. So you can't force people to do certain things, especially with their kids. That's not a policy I ever would support. But it's been there. So you still have the ability for any parent, if the mandate is removed, or any district to come up with their own policies that can still do things. Any parent can still have their child wearing a mask if they want to. Any faculty member can still wear a mask. And we can make sure that there's highly effective masks for those residents. But it gives the districts flexibility to make their own policies based off of what they're seeing. We are unique that we have this asymptomatic testing program where we're going to be able to see things if you take masks off. If the state removes their mandate, they take them off, we're going to be testing still. And we'll see things if that has an impact or if it doesn't. I think the challenge in this pandemic now, at this point, when you have declining cases, hospitalizations are going absolutely in the right direction. We have this contagious variant that doesn't get people as sick. That doesn't mean it doesn't get people very sick. Some people get very, very sick. But overall, we have to balance out everything else. And we have to balance out what's going on with suicide, and we have to balance out what's happening with mental health with kids in schools. We're investing millions and millions of dollars. I was in Washington, D.C. just yesterday talking about this, and it's a national crisis right now. So you can't ignore that, and you can't ignore that that might be a bigger problem right now than the actual virus in schools. So I think right now it's time to lean forward and regain our balance. Hospitalizations are the key number for anything, because it's about our ability to treat our sick. And if we can't treat our sick, then we have a real big problem related to overall public health. But I think that would be the key there. Glenn, I think your hospitalization numbers your hospital's got to be in good shape. Obviously, asymptomatic testing to make sure you're not having peaks in any of these buildings. And if you are, remember the whole process of the screening. Beforehand, the goal was we're testing in schools, we're getting a wide array of individuals. I think we tested in over 138 schools last week. If we see something in one of them, we go in and we test even more than just the sample, right? And so that, I think, is an approach we take moving forward. I've seen some people suggest you shouldn't move forward with unmasking until 4-year-olds can get vaccinated. I just don't agree with that because the 4-year-olds typically aren't in the same buildings as every other kid for the most part, and we don't know when that's going to happen. It looks like those trials are slowing down, so that's not an excuse to put everything else on pause. So I don't think there's one real metric. I don't think we're going to see parents vaccinating their kids at the same rates that the adults have vaccinated. I think it's been out there long enough. I think it's not practical to think that this is going to happen. So we need to figure out how we move forward. And I think that's where the public at large is as well. This is a virus that's going to be with us. How do we live with this? How do we move forward? And that's what I think we're trying to balance right now.
Ryan, what's the difference between taking masks off now or waiting the 2 or 3 weeks from when the governor is saying that they could come off, that being after the midwinter break? What's sort of the difficulty in waiting those 3 extra weeks right now?
Well, I think it's creating a level of anxiety, Tony, within the community, within families, within kids. And I would volley the question back to the policymakers. What is the difference? What do you know what's going to happen in 3 weeks that you don't know is happening now? And the answer is they don't know anything different. They're making a calculated bet that things will just be better. And so I think the reality is that there's a level of anxiety with this mandate. And it does have an impact on kids, and it does have an impact on kids' developmental growth related to especially little kids when they're working on different things, including learning how to talk. So these do have an impact. When you're in the midst of a public health emergency, you have to look at everything in balance, and then you balance on the side of the public health emergency. This is not an emergency at this point. This is something that's serious, and this is something that we've built up infrastructure to address. So to wait an additional 2, 3, 4, 5, 6 weeks, whatever it is, without metrics and without being able to explain those metrics, I don't think you can justify it. If they can explain the metrics they're looking for, even if you disagree, at least you understand what those metrics are, and you can watch the data each day to see if we can get there.
Staying in the school lane, so I know the state's going to be distributing those at-home test kits for kids. This is sort of a two-part question. Earlier you mentioned if someone calls the county, let's say a resident in Van Buren, they want an at-home test kit. If they call your office, can they get one that day, or do you have to then sort of schedule that out, say, you can pick it up at the town hall, they're doing a distribution in a week? And then second part is the county planning to do any sort of additional testing when kids do return from that midwinter break, specifically at the county level?
We'll do the same testing program we do each week. We want to encourage more people, specifically if masking goes away, that more people participate in our testing program in the schools. I don't think we've decided, Tony, if we're going to do like a back-to-school testing effort. We may. But if someone needs a test kit and for whatever reason they've missed distribution points within the towns, because each week we're getting out, or say every 10 days, we're getting out 20, 30, 40,000 kits to our municipal partners. But certainly if somebody runs into a scenario, they can email us. We'll find a way for them to get test kits.
Staying in the school lane, so I know about a month ago you mentioned that you guys were looking to bring contact tracers on for schools. What's the status of that? Is that something the county's still looking to do?
At this point, the numbers have gotten much more reasonable. When we're looking at that, we're in the peak of Omicron. We knew that in other countries it went up high very fast and then it went down very fast. We weren't sure if that was going to happen with us. It has happened. So looking at case levels, again, if you're looking at, I think yesterday we had 49 cases, right? I think between the school-age kids, we might have had 10 cases countywide, right? So now those kids probably may not even have been in school during the 5-day period, right? So you might not have even had to do it. So I think the case levels are at a manageable level related to what we're asking the school districts to do. Again, if something changes, and again, this is all, in our conversations even today with our team, we're, thinking, when does wave 5 happen if it happens, right? And so this is, we'll plan and prepare for wave 5 and what we know worked well and what we know needed improvement, and be ready for that. But right now, it looks like the wave is coming down very much to where the case levels were before in October and September. So I would think that's going to continue next week and the following week as well.
A lot of districts are maybe not quite to say what their position is, at least to us, on masking, but are you hearing from the majority of districts that they were interested in having optional masking policies?
Yeah, I actually have a letter here that I was copied in on from about 20 superintendents, pretty much taking the same position I've taken, that they're ready to look at the psychology of what's happening in their buildings, and they're ready to lean forward. And they know they have a partner here with us that will help them any which way to do that. But it's certainly very frustrating for families and that want to move forward, and they see other states moving forward, and we're not quite there yet, even though arguably we're doing better than those other states.
Is that letter something that could be shared with the media, or is that?
Yeah, I mean, they emailed it to me. You could foil it. All right, send me a foil, Tony. We'll get it to you.
Also talking about vaccines, I don't know if you've looked, let's say over the past month or so, vaccine distribution for people who have completed the series has remained pretty stagnant, give or take a couple thousand. Your thoughts as it sort of, I guess, I don't know if peak vaccine is the right way to phrase that, but do you think we were almost sort of plateauing with vaccine at this point, obviously until those kids 5 and under can get, or under 5 can get vaccinated? Any effort to push vaccines again?
Yeah, I think overall with new vaccinations, it's going to be hit or miss. I do think we've been asking for some pretty detailed information related to boosters. I think there's opportunities with boosters to, once we have data and we can really look into what areas of the community are lagging the booster shot, then we can get more aggressive and targeted for booster shots. But I do think related to trying to get your numbers higher with new vaccinations, we're probably not going to see it move too quickly until there's a new category of eligibility. And I think under that eligibility, again, you're not talking about your smallest people, right? So I do think there's going to be even a greater reluctance, probably due to much of the the politics of what's happened over the last 2 years with this.
Are you hearing any ideas from the state about what roughly their metric might be if they decide to fill one out?
We haven't heard anything. I put a letter out. I've asked that question privately many times in our various interaction. I don't think there's a solid metric, and I think that's frustrating for people, including myself.
Couple questions off of the weather that we're supposed to be getting over the next couple days. Some heat, more or less. Has the county been in contact with local DPW crews just to prepare for possible water main breaks, ice jams, anything like that?
Yeah, so what we do related to that is we are engaged in a couple ways. One, most of the water pipes are owned via the City of Syracuse and or the Onondaga County Water Authority. What we do is we partner with them on a health department basis, and then oftentimes If they have a real challenge, our WEP teams at Water Environmental Protection will help as well. So they work together on a daily basis. So when you have snow and then you get maybe rain and the snow melts, it's a disaster for us at WEP, because you have what's called inflow and infiltration, I&I. You have clean water getting into the wastewater, which takes up capacity constraints at your wastewater treatment plants because of old pipes. Those are usually busy days for both the city water department, the county water authority, and our WEP team. So they work pretty hand in hand on those.
Are you guys prepared for all that?
Oh, they are. They watch that. They watch the weather very closely. Rain is not friends of wastewater treatment facilities.
What message would you give to residents? What advice? If they encounter a water main break, if they encounter an ice jam, what would you tell them?
Yeah, I think just, it'll be our job to make sure that whether a reverse 911 call is needed or any sort of communications, if something happens where you're not getting water or anything like that, just maybe pay attention and look at what's going on in the media, and you'll get a timeline communicated with from that municipality that is on the job. Yes.
I have a question about regular the mall.
Oh, okay.
My understanding is that they're not set up on their taxes, correct?
Yeah.
Okay, so what are your next steps as a county?
So these are, when I became county executive, we took a very aggressive approach towards delinquent taxes. We make towns and villages and school districts whole of tax collection. So what that means is the town will assess a property that creates the tax bill. We pay the town government. If there's a village, we pay the village government. And if there's a school district, we pay the school district. So the county is the one who's out that money that we took out of our own checking account, and we're out the money we're supposed to get paid. This specific entity has entered into multiple trust agreements, which are essentially payment plans. And they have made payments, and then they've broken that. And so at this point, we're watching the situation closely. Obviously, we have a history of taking on properties and owners who are not responsive to the community and to the taxpayer, and we've actually taken them to the limit with Shopping Town Mall with Moonbeam. So I think the owner understands we're willing to do things we need to do, but at the same time, we aren't going to discuss legal strategy from the podium today. Other questions? Okay, thanks everybody.